Another way to look at constipation is look at kidney. And again, the kidney can be involved from a kind of different point of view. The kidney controls the, almost we can say, the sphincters or the two lower yins of the body. And for different reasons, can be from internal fear, it can be also from just a more condition that the patient is holding on to a fear, or it's been affected more deeply that the anus is not working properly. Then suddenly we resort to kidney points. Then suddenly we think about kidney 4 or kidney 15 or bladder 23, or bladder 23 and bladder 25. And sometimes again stomach 29. So if you see more kidney involvement in the constipation, you would see that all the other points are not working. You suddenly have to move to use more kidney channel, or addressing the fear, or addressing something, that the person is afraid of losing control on some basic functions of the body. Again, if it's more dryness of fluids of kidney in dryness, then kidney 6, spleen 16, spleen 6 will be major points for it. If there is a general yin deficiency, not stomach yin deficiency, then we need to tonify through kidney in. Otherwise, the treatment will hold very short time, and then the constipation comes again. So suddenly you will address even kidney 6, spleen 6, and the patient is not just relieved after the treatment, but they have a long-term relief from their constipation. Kidney yang is also involved in the movement, and when the kidney yang is very especially deficient, there will be no movement. Then we'll treat kidney yang, and suddenly there'll be better bowel movement. The constipation of kidney is not so dramatic. It's like a small constipation. It's like a constipation they have some bowel movement, but not full. They have some problem, but not constant. And more you see all the kidney symptoms, like they're very tired in the end of the day, they look emaciated, So you do kidney 9 or CV4, and then suddenly the bowel movement is better. So you see we are moving suddenly to treat different points because the reason for the constipation is different. And also when you hear the kind of terms that people will talk about the constipation, I have a little movement, but not so much, So sometimes more, sometimes less. And you see these kidney symptoms are more evident. Another reason obviously is heat, and if you have intense heat and fevers, we talked about fevers, then you just reduce generally fever. That's a classical combination, large intestine 4 with large intestine 11 with triple warmer 6, again reducing heat very strongly. You can even use GV14, stomach 44, all points to reduce heat in the body. In that respect, we sometimes use spleen 14 or spleen 15, but again, the other points will be the more important ones.